Welcome to our CNEcl snapshot of the week. I'm happy that you're back. We're going to be talking about technology and nursing education. Remember that this is how you can reach us and to go ahead and subscribe to this channel so you can be alerted every single time we go live. We go live pretty much or record a video at least every 7 to 10 days. This is going to make sure you have the most current information. Also, we are continuing to hear great feedback from nurse educators about their confidence in preparing for the exam and using our resources. So we're always thrilled to hear how you're doing on your journey, and would love for you to reach out to us at info@𝐷RCellers.educate.com. If you have any questions as you move forward to achieving success on the certification exam. When we talk about technologies, just for your reference, I want you to take a look at Dr. Caputi's review book on table 1.4, and it is on page 9. There are 5 different components when we think about the teaching learning process that's involved in the nursing curriculum. Our teaching and learning opportunities to use technology and to connect with our digital natives is what we call them, those students that have been using smart devices, whether smartphones, iPads, ever since they were a toddler or at a young age. So how we integrate those technologies in the classroom and clinical skills lab, simulation lab, and online learning is going to be different. There's a great list of resources that are out there on table 1.4. And if you want more detailed information about what those are, go ahead and join our membership. We just went over this during our boot camp just last week. That's where you're going to find a recording that's going to go in depth into these specific areas because they are, again, unique. The setting of the learning that happens in the nursing curriculum is variable, and we want to ensure that we're using technologies at each component in the process. Sage on the stage versus a guide on the side. If you've heard those terms, then you are in alignment with what we wanted to share when we talk about technology empowered learning. We want to connect the dots for the students. We use that through technology. It's going to promote higher levels of engagement and incorporate those high impact practices that are seen as the best evidence for teaching strategies that are going to close the gap, the knowledge gaps for our nursing students, and also allow us to connect with our students from a student faculty standpoint in transference of knowledge. So Sage on the stage is known as that traditional podium lecture that happens versus the ability for us to guide students in their learning, to help them have what we call those light bulb moments, those aha moments, where they realize how the content and constructs that they're learning in the classroom connect with the clinical setting and their ability to apply those clinical concepts. A couple of different strategies we can use: flipped classroom, wikis, which are discussion forums. Now we have those incorporated into most of our learning management software systems, audience response systems, or ARS, mobile devices, and social media. Go ahead and take a look at Billings and Halstead chapters 19 through 22 to give you more information. To wrap up our snapshot, this is just one of our practice test questions that we reviewed in our boot camp. So this is a chance for you to see what that practice test question looked like. We go over it, the rationale for why one of the answers is correct and the other 3 are not. You can use as a reference Billings and Halstead, page 422. That's where you're going to find information about what strategies we should use to design courses and learning activities. All right, this has been Dr. Sellers Educate Snapshot, and I'm happy that you were here. Hopefully you learned something new about technology and nursing education. If you want more in-depth knowledge, then head on over to our site, and that is www.drsellerseducate.com. You're going to see a list of all of the events that we provide to support our nurse educators on their journey. We're also happy to announce that we have our brand new study workbook available. That's right, we have been listening to your request, and we are very excited to share this workbook with you. This is how you can find it, and as always, we are excited to support you and happy that you're here, and we'll see you next time. Have a great one. Bye-bye.